Dr. Satarupa, working as a cardiac intensivist in Birla Heart Research Center. Today we are going to discuss about management of cardiogenic shock in children. Cardiogenic shock is the condition when the heart is not able to pump adequately to meet the demands of the body. It can happen to small children who are already known to have congenital cardiac conditions like a congenital heart disease, or it can happen to any kid who is affected with a viral illness when it is called as viral myocarditis. So it's a case when a heart fails, when the heart is not able to pump blood to give adequate urine output, to maintain the sensorium of the baby, or to maintain the other normal activities of a baby's body. If a parent brings a child who is having these symptoms, like the baby is not waking up properly, the baby is breathing faster, or the baby is having cold extremities, the baby has not passed urine since morning, is having high grade temperature, the baby, when is brought first in the emergency, we need to assess the baby and then bring the baby to the pediatric intensive care unit, where it needs to be monitored with a multi-para monitor giving information from time to time of the baby's condition. The conditions which we need to monitor are the saturation of the baby. Like if the baby is having a low saturation, that is low oxygen in the body, we need to give oxygen to the baby. Then we need to monitor the heart rate of the baby, which is very important. We need to attach ECG leads and connect the ECG lead to the monitor, which will give us the heart rate of the baby. In case of cardiogenic shock, usually the heart rate is very fast. And then if we detect it by the monitor, we need to assess the rhythm of the baby. Then we need to monitor the blood pressure of the baby. In cardiogenic shock, the baby's blood pressure will be very low, the baby will have very low volume pulse, and the baby's extremities will be very cold. Then we need to assess the breathing of the baby. The baby usually will be breathing very shallow or will be breathing very faster. We need to support the breathing of the baby. If the baby is breathing faster or needs some support, we need to put a bag mask to support the baby's breathing. And still, if the baby is breathing less, then we might need to intubate the baby and connect the baby to the ventilator. To support the blood pressure of the baby will need IV cannulation in the form of IV cannulas, and we need to give fluids and other medicines called inotropes to increase the baby's blood pressure. Inotropes are medicines which will increase the blood pressure, will help the heart to pump the blood in the body. Then we need to support the other organs of the body, like the kidneys and the liver. These things can be done in the form of medicines which will increase the blood pressure and thereby will increase the blood supply to the kidneys and the liver and will improve their function. If the kidney still fails, then we might need to do a dialysis for the baby to support the heart and the kidney. If the baby's sensorium is not good, if the baby is not opening up eyes, we might still need to increase the blood pressure to see what's happening. Then we need to do an echocardiography to see what is the condition, whether the baby is having any underlying cardiac condition that is predisposed to such a cardiogenic shock, or it is just a case of a child with viral myocarditis. To support, still, if we are not able to meet demands of the body, the heart is still failing with all these medicines, we need to support with mechanically the heart in the form of ECMO, which is extracorporeal membrane oxygenation. It will be an artificial machine to support the heart. And in that case, we might be able to support the baby's organs and cure and give time for the heart to recover from the cardiogenic shock.